Hi, my name is Piali.
And my name is Cheyenne. We're both seventh graders that go to Keeling Middle School.
This is our project, an interactive voice assistant to track seniors' daily medical readings.
Our project idea started almost 2 years back. Our grandma checks and records her blood pressure and sugar multiple times a day. She writes it down on a piece of paper. Sometimes she loses the piece of paper or she forgets to write it down. We consulted her healthcare nurse and she said that was a problem for many seniors. The critical data often doesn't reach their doctors. Our grandma, like 40% of seniors, does not have a smartphone. Our dad presented her with the Amazon Alexa and she loved it. It was very easy and a natural interaction for her. We decided to write a program where we could use voice-to-voice interaction and that could store her measurements. The problem was we didn't know how to do that yet. Over the last 2 years, we have gone through the journey of learning programming through two school courses and a summer-long online MIT X course. We also consulted healthcare professionals as well as researching existing products. We finally developed a solution of a fully functional 600 plus lines of Python program on Raspberry Pi using the Google AI Kit. We presented our solution to our school, regional, and state science fairs, and the Raspberry Pi Foundation's coolest projects. We are currently working on phase 2 of the program.
Around 12 million seniors have high blood sugar. A non-controlled diabetes can cause damage to the organs. So a doctor can look at an average blood sugar or A1C every 6 months, but this does not provide any information about the daily trends or fluctuations. So, for example, if they see a spike every afternoon, they can adjust the diet or what time they take their medicine to control the diabetes better. So most of the data is critical to manage diabetes, but it never reaches the doctor due to manual recording. So the doctors don't have any data-driven way of managing the treatment.
Around 78 million adults have high blood pressure. There is no average for blood pressure, and the measurement taken at a doctor's office every couple of months is insufficient because it does not provide a daily fluctuation as well as a long-term average. The studies show that people tend to get their peaks early in the morning or late in the evening, which is outside most doctors' visiting time, and some individuals experience high blood pressure in a medical setting.
So we found some current types of market solutions. First is a device with no connectivity, but the problem is that there's no way to store any of the data. Second are devices with a Bluetooth connection and an app, but there are several problems with this. First, the senior would need to have a smartphone. However, more than 50% of seniors do not have a smartphone. Second, there are multiple apps. There's one for like blood pressure and another for blood sugar, and there are different apps for different manufacturers. So this means if a patient had an Omron 10 series and then it died and they decided to switch to iHealthTrack because it's cheaper, then they would have no way to get the data from the Omron onto the iHealthTrack. So this means between manufacturers, the data is fragmented and not portable. The last solution that we found was a continuous glucose monitoring system, but the problems with this are first, it doesn't work with blood pressure, it only does blood sugar. Second, it's expensive, so it's only used in critical cases. And lastly, the data is not portable. So here are our engineering goals. First, we want this to be easy, intuitive, and interactive to use using simple voice commands. Second, we want to make sure that the senior is able to enter the data using a single application, which means they don't have to purchase or manage any other apps. So third, we want to make sure that the different types of measurement data are stored together in one centralized location. And we want, on the senior's request, that they can send results of their graphical representations to the doctor. And last, we want it to send alarms and alert the caregiver for critically high or low data. This is part 2,
Which is engineering design.
While me and Shen were looking for a solution, we came across an issue of the MagPi magazine that introduced us to the AIY kit that was released by Google. So the kit consists of the Raspberry Pi and an AIY hat that process the speaker and microphone signals to allow the Python program to use the Google Assistant for voice. So the speaker consists of the AIY hat, the Raspberry Pi, the speaker, and the microphone. We use Thonny and Python to develop our code.
build our design, we wrote our wish list in a whiteboard and divided them into different categories and wrote plans for each category with specific functions. So here's the categories. The first category is the configuration category, and the user can say configure name to PLE, for example. The second category is the statement category, and the user can say my sugar level is 120, for example. The next category is the question category, and then the user can ask what was my sugar on January 15th. Next category is the alarm category, and if the measurement is too high or too low, the senior assistant automatically sends an email to the caregiver. The next category is the email category, and the user can say email my blood pressure report or email all reports. So here's the process of how our program works. So for example, if someone says my blood pressure is 120/70, the speech goes into the microphone, which goes into the AIOI hat, which goes to the Python program, which is inside the Raspberry Pi. So they need to give the speech to the Google Assistant APIs inside of the Google Cloud to convert it into text. And while the Google Cloud is converting, the Python program is waiting for the events. For example, like these. When they send back the event finished processing, the text comes back to the Python program, and the Python program immediately tries to find the category using the keywords in the sentence. It then processes the data and then returns the response text to the Python program, which gives it to the AIOI hat, which gives it to the speaker, and they'll respond, your blood pressure was recorded.
So this is the program execution. First, the Python program starts. It goes to the main, which reads the current configurations, and it reads the JSON configuration to a dictionary. So then it gets the assistant authentication and starts the assistant and loops on the events from the assistant. In the process events, if the event is the recognized speech, it gets the text of the speech, and for the find category, it finds which category the text belongs to using the keywords. So it looks for the keywords in the speech to find one of these 4 categories. If it's not in these 4 categories, then it'll go to the Google Assistant. But if it is in these 4 categories, then it'll go to one of these 4. So the first one is the process statement. So it extracts the measurements and then stores the data to the CSV file. And then for the process question, it gets the data from the CSV file and then processes the question and then sends it out. And then in the process email, it emails the results with the graphs, and in the process configure, it stores the configuration to a JSON file. This is part 3.
Data analysis. The data is stored in a CSV file. There are 2 ways to get back the data from our program. The first one is to ask for a single day's data, like for example, what was my sugar on January 15th, and our program would talk back with the readings. The second way is to ask the program to email the data, for example, email blood sugar report or email all reports since January, and our program sends an email of the readings to the caregiver.
This is an example of what the caregiver would get. So they would get over here the date, time, and sugar level. And here on the x-axis, it has the date and time, and then on the y-axis, it has the sugar level. Our grandma measures her levels every day, but her response to the nurse's inquiry is usually my pressure was good or my sugar levels were 130 yesterday. So here we have a graph that would get sent in an email to the doctor, and unlike my pressure was good or my sugar was 130 yesterday, you see all the fluctuations. So this blue line represents the sugar, and each 3 points is equal to 1 day. So there's the morning, the middle of the day, and the evening. And as you can see, there's a spike on each of these days in the middle of the day. So this could be an after lunch spike, and if the doctor sees this, they can control the senior's diet when they take their medicine and when they exercise to control it better. And this is opposed to this red dotted average line, which is the A1C, and that's only a moderate average. And doctors would get a lot more and be able to control the diabetes better if they have all the daily trends and fluctuations.
The lack of an easy, centralized, and inexpensive way to store day-to-day measurements is a serious problem for the medical community. Doctors have to depend on statements such as, "My pressure was good," or "My sugar was 130." Our device can give a comprehensive way to see daily trends and fluctuations. This can help doctors take a data-driven approach to plan better treatment management, adjust medication, and suggest patients about lifestyle changes. The graphs can give seniors a visual representation of how they are controlling their symptoms. It can be motivating for them to control their symptoms as well. So here are some feature enhancements to our program. The first one is to store reasons for measuring fluctuations. The doctors can get more insight if they have a description of why the patient's blood pressure or blood sugar is too high or too low. We are working with healthcare professionals to make a list of questions that doctors might ask patients, so if the senior assistant detects that if the patient's blood pressure or blood sugar is too high or too low, it can ask the questions. The answer will be stored with the readings for analysis. The next one is privacy, data security, and multi-user. We can use the Google Assistant's built-in voice match and authentication for permission, privacy, and compliance. This will also allow multiple seniors to use the senior assistant. The next one is to convert stored results into CSV files to the database. The last one is to remind seniors to take blood sugar and pressure measurements in certain times.